Hello soon-to-be parents. Today we are going to be discussing about how to create a birth plan and prepare for delivery, especially pertaining to the Indian scenario. A birth plan helps you to communicate your preferences and also ensures that your birth experience aligns with your wishes. First, let's discuss about the delivery location. Discuss with your doctor about whether you want to get delivered at a maternity home or a multi-specialty hospital or even the option of a water birth. Think about your labor environment. Most Indian parents prefer to have their family around them during delivery. This is called the birth companion. Discuss with your doctor who would be allowed inside the labor room, whether it's your spouse, mother or mother-in-law. Next, let's talk about breastfeeding. Breastfeeding is an important aspect of postpartum care of your baby. So if you prefer to breastfeed, talk about it upfront with your healthcare provider. Or if you prefer to do formula feeds, discuss about that too. Next, let's talk about epidural analgesia or any painkillers during pregnancy. Discuss your preferences for pain management. Natural methods like yoga and meditation may help, but also ask them about the medical relief of pain in the form of epidural analgesia, which not only helps to relieve the pain but also helps to speed in the delivery process. Discuss with your insurance provider about the package inclusions, cashless facilities and other options, and whether this insurance applies in the hospital where you're planning to deliver your baby. Next, let's talk about your baby's postnatal care. Discuss with your doctor about the vaccination schedule, cord blood banking, and also birth registration. Keep your birth plan concise and flexible. Remember, labor is highly unpredictable, so be prepared for changes. For more information on being prepared for childbirth, please follow our channel. Stay informed and take care. Hello soon-to-be parents, I'm Dr. Ramya. Congratulations on your pregnancy. Your visit to the prenatal clinic is your first step to meeting your little one, and I'm going to walk you through it. When you first come to us, we would like to confirm your pregnancy using an ultrasound scan, which is called the early pregnancy scan, though you would have confirmed using a home pregnancy kit. Next, expect to discuss your past medical history, any history of previous surgeries, your family history, and chronic medications that you are taking. This will help your doctor to assess any potential risks during this pregnancy. Lab tests are an important standard part of your first visit. Blood and urine tests check for a variety of things like your blood group, Rh factor, and various infections that can happen during pregnancy. Next would be lifestyle modifications and nutritional choices that are important for the crucial development of your baby. Feel free to discuss your existing lifestyle so that your doctor can suggest what modifications need to be done. Before you leave, please feel free to discuss with your doctor about the schedule of your future visits, also any prenatal screenings and prenatal classes that she would recommend. Last but not the least, this is your time to plan and prepare. So feel free to discuss anything that is on your mind. We are always here to support you. Hello soon-to-be parents. Today we are discussing the importance of prenatal vitamins and how they supplement a healthy diet during pregnancy. First, let's talk about folic acid. Folic acid is crucial for the baby's brain and spinal cord development and helps to prevent neural tube defects. The natural sources of folic acid are green leafy vegetables, citrus fruits, and beans. However, prenatal supplement of at least 400 microgram is required to ensure that we get enough. Next, let's talk about iron. Iron is vital for the baby's development and to prevent iron deficiency anemia. Iron-rich foods are lean meats, legumes, lentils, and dry fruits like dates, and it's also found in jaggery. Due to increased demand during pregnancy, most Indian women are required to take prenatal vitamin supplement of iron during pregnancy. Next, let's talk about calcium. Calcium is vital for the development of the baby's bones. Calcium-rich foods are dairy-based products, plant-based milk, and other green leafy vegetables like spinach. Finally, docosahexaenoic acid, also called as DHA, it's an omega-3 fatty acid which is present in fish like salmon, kidney beans, and other nuts and oils. Docosahexaenoic acid is vital for the baby's brain and visual development. Now that we know about the prenatal vitamins, how do we go about it? It is ideal to start preconceptual folic acid along with DHA 3 months prior to your conception, and it is best to continue it 3 months into your pregnancy too. From your 4th month onwards, you're required to take a supplement of iron and calcium. A well-balanced diet containing whole grains, fruits and vegetables, calcium and protein is crucial along with this prenatal supplements. However, consult your doctor before you start on these prenatal vitamins. Thank you. Hello soon-to-be parents. Pregnancy is a journey filled with joy, but it can bring along with it unexpected challenges too. Today we are going to talk about the common complications during pregnancy. Our goal is to keep you informed and prepared. So first, let's talk about hyperemesis gravidarum. What is hyperemesis gravidarum? Morning sickness or vomiting during pregnancy is quite common occurrence, but when that becomes excessive, it is defined as hyperemesis. So when you feel excessively tired or dehydrated or unable to do your day-to-day activities, please seek help from your doctor. Next, let's talk about miscarriages. Miscarriages are a deeply emotional and physical event. The first symptoms of miscarriage could be crampy lower abdominal pain, low back pain, or spotting or bleeding through the vagina. So when you have these symptoms, it could be the early signs of a miscarriage. There are various reasons for a miscarriage, which include hormonal imbalances, unhealthy pregnancies, or genetic abnormalities in the growing baby. 60% of first-time pregnancies don't make it, so don't panic. Now let's talk about gestational diabetes. Gestational diabetes means high blood sugar in the mother during pregnancy. When the baby is exposed to high sugar levels in the mother's womb, most of them tend to develop type 2 diabetes later on in their life. So it is very crucial to ensure controlled blood sugar levels during pregnancy for your health and your baby's development too. Now let's talk about preterm labor. Preterm labor is when labor onsets before 37 completed weeks of pregnancy. What are the signs and symptoms of preterm labor? They include increased contractions and changes in the vaginal discharge. So when you face these symptoms, seek immediate medical attention, and preterm labor can be prevented by various medications. Though these complications are scary, with the right care, with the right team, all of them can be either prevented or managed effectively. Hello soon-to-be parents. Today we are exploring ultrasound and what you can expect at different stages of pregnancy. Ultrasounds are safe for your baby and non-invasive and play a crucial part in your prenatal care. In the first trimester, during 6 to 9 weeks, when you come to your doctor for the first time, we do a scan called the dating scan. In this scan, we confirm your pregnancy, check your baby's heartbeat, and also tell you the expected date of delivery or your due date. This is an exciting part of your pregnancy as you get to see your baby for the first time, though it is a tiny blob on the screen. Around 11 to 14 weeks, we do something called the NT scan or the nuchal translucency scan. This scan is being done to find out what are the chances of your baby having chromosomal abnormalities like Down syndrome. This is a part of wider screening process which includes blood tests too. In the second trimester, that is between 18 to 22 weeks, we do something called the anomaly scan. In the anomaly scan, what we do is we check for each individual part of your baby from the head to foot. We ensure the growth of the individual organs like the baby's brain, heart, kidneys, and spinal cord. In the third trimester, we do a minimum of 2 scans called growth scan. The first one is done around 28 weeks and the second one is done just before delivery. In a growth scan, we assess the weight of the baby, the fluid around the baby, which is called the amniotic fluid index, and also the blood flow to the baby, which is called the Doppler studies. Apart from these routine scans, you may be subjected to other ultrasounds called fetal echocardiogram or an early anomaly scan or an A5 Doppler, depending on the necessity. Remember, asking for the sex of your baby is illegal in India. This is being strictly enforced by the Government of India to prevent female feticide. So kindly avoid putting your healthcare provider in a delicate position by asking for the sex of your baby. Thank you. Hello soon-to-be parents. Today we are delving into the early signs of pregnancy and the underlying biological changes. Understanding these signs can help you recognize the very first hints of pregnancy. First, let's talk about the missed period, which is one of the clearest signs of pregnancy. This is due to the hormone beta-HCG, which starts to increase in your body, which prevents the breakdown of the ovarian corpus luteum, which leads to an increase in the progesterone level in our body, which is required for a healthy pregnancy. Next, let's talk about morning sickness. This is due to the increased levels of beta-HCG and estrogen in our body, which are crucial for the early stages of pregnancy. These hormones affect the part of the brain that controls nausea and vomiting. Remember Remember, this doesn't happen only during morning. It can happen at any part of the day. Next, let's talk about excessive tiredness. This is due to rising levels of progesterone in our body, which supports pregnancy and increases during the first trimester. Progesterone also causes us to feel excessively sleepy and drowsy. Now let's talk about the other changes that happen in your body. Your breast might feel swollen and tender due to the rising levels of estrogen and progesterone in your body. Mood swings are also common as these hormones affect the neurotransmitters in the brain. Now let's talk about changes in appetite and dietary preferences. These are also due to hormonal changes in our body. For instance, increased progesterone levels in our body tend to slow down our digestion and also makes us feel fuller for longer. Remember, every woman and every pregnancy is unique. So stay informed, listen to your body, and join us for more insights on anything related to pregnancy. Hello soon-to-be parents. Today we are going to talk about postpartum care and what you can expect after giving birth. This time is crucial for your recovery and also your baby's well-being. First, let's talk about physical recovery. After giving birth, your body needs time to heal. You might experience vaginal discharge called lochia during this time, which can last for several weeks. Usually, it decreases over time. Also, if you had a C-section, you would have to take care of your wound and look out for signs of infection. Next, adequate rest is required. Your baby would have an irregular sleep pattern during the first few weeks of delivery. So, sleep when your baby sleeps. Please feel free to ask support from your friends and family. Next would be emotional support. You might experience a mix of joy, depression, sadness, tiredness, and fatigue during this stage, which is quite common. If you feel persistently sad or depressed, please seek professional help. Breastfeeding is another important aspect of postpartum care. Breast milk may take a few days to settle, and breastfeeding can be a challenge initially. Please feel free to ask the help of lactation consultants or your gynecologist. Your first postpartum checkup is scheduled usually 1 week after delivery. During this time, your doctor ensures that you are healing well and do not have any infections. During the next visit, which is usually around 6 weeks later, please discuss your contraceptive choices so that you can plan your next pregnancy with an adequate time gap. Self-care is vital during this time. So having a balanced diet, adequate rest, light exercises, and staying hydrated is essential for your recovery. Remember, taking care of yourself helps you to take care of your baby better. Hello soon-to-be parents. Today we are going to dive into the essentials of prenatal nutrition. Eating right during pregnancy not only supports your baby's growth and development but also ensures your overall well-being. What you expose your baby to while inside your womb has a long-term impact on the baby's health long after he or she has left your womb. So let us look at the top foods for a healthy pregnancy. Eating a balanced diet during pregnancy is very important. First of all, carbohydrates. Incorporate whole grains like oatmeal, quinoa, and whole wheat bread. These are power-packed sources of food and help you get you through the day. Also, they are rich in fiber, so help in preventing pregnancy-induced constipation. Next would be proteins. Proteins are the building blocks of life and are essential for the baby's growth and development. Lean meat, eggs, legumes, and lentils are very good sources of protein. If you are vegan or vegetarian, look for alternate sources of protein like tofu, soy milk, almonds, etc. Next would be healthy fats. Avocado, nuts, seeds, cold-pressed oils like coconut oil and ghee are rich in fatty acids, which are required for the baby's brain development. Omega-3 fatty acids are found in foods like sardines, mackerel, kidney beans, and walnuts, which are required for the baby's brain and visual development. Next would be calcium. Calcium is a building block of the baby's bones. Milk, cheese, butter are excellent sources of calcium. If you are lactose intolerant, look for alternate plant-based sources like almond or soy milk. Finally, let's load up on fruits and veggies. They are rich in essential nutrients and vitamins. It's always better to eat cut fruits and salads in place of smoothies or fruit juices because it's better to avoid added sugars throughout pregnancy. Also, green leafy vegetables like broccoli are very good sources of folic acid which help in the baby's brain development and hence prevent neural tube defects. At this time, it is important to take folic acid supplementation in the form of pills for the sake of the baby's brain growth. To summarize, eating a balanced diet which includes carbohydrates, proteins, healthy fats, calcium, and fruits and veggies are very important. Finally, remember, taking care of your nutrition is a vital part of taking care of your baby. Stay healthy and let's see you next time. Hello soon-to-be parents, I'm Dr. Ramya. As you approach the final few weeks of your pregnancy, preparing you for labor can help you feel more confident and calm. I will share a few tips on how you can get ready for your big day. First, educate yourself. Attend prenatal classes and learn about breathing techniques, relaxation techniques, and the stages of labor, and also what are the pain relief options available. Next, create a birth plan. Discuss with your healthcare provider about the place of delivery, who will be allowed inside during delivery, and also the pain relief options. Pack your bag in advance. Remember to include comfortable clothing, toiletries, baby clothes, and also things that relax you like good books or music. Stay active and practice relaxation techniques. Mild exercises like walking, swimming, or prenatal yoga, even up to the 3rd trimester, is very useful. Also, meditation and breathing techniques also help you to relax and enjoy your labor. Know the signs of labor. These include lower back pain, regular contractions, and breaking of your water. When you get any of these symptoms, please immediately contact your healthcare provider. Also, build your support system. Keep yourself surrounded with positive and like-minded people, maybe your partner or friends or family. Remember, each and every labor experience is unique, so trust your body and the guidance of your healthcare team. Hello soon-to-be parents, I'm Dr. Ramya. Pregnancy is a joyous time but can also bring with it a whirlwind of emotions. Feeling emotional, stressed out, and anxious during pregnancy is quite normal. 6 tips to avoid stress and anxiety during pregnancy. First of all, it is important to understand and acknowledge the fact that feeling stressed and anxious during pregnancy is quite normal. How do we go about handling it? Engaging in light, regular exercise during pregnancy is very important. Be it yoga, swimming, or just a simple walk. Pick one exercise that you like and make it a part of your routine. Now that we have worked out, it is important that we eat well. Eating a balanced diet during pregnancy is very important. Eating foods rich in omega-3 fatty acids like sardines, mackerel, kidney beans, walnut, and foods rich in magnesium like spinach help to regulate our mood. Now that we have worked out and eaten well, the next important thing is adequate sleep and rest. It is important that we sleep 6 to 8 hours during pregnancy. Avoid caffeine and pick out a relaxation technique like meditation before bedtime. Now that we have done everything that we can by ourselves, and still if you feel stressed out, please feel free to share whatever you're going through, your emotions and feelings, with your close family, friends, and support group. Just talking about what you're going through will help to lighten the emotional load. Despite having done all this, if you still feel stressed out, please feel free to seek professional help.